Malignant melanoma is a dangerous form of skin cancer, and if allowed to spread too far, can become very vicious and deadly. Researchers have spent their entire careers researching malignant melanoma in an attempt to improve outcomes for the patient and increase the chances that they can recover from the disease and return to a healthier life. New evidence suggests that a certain class of medications, known as GHRh inhibitors, may be able to enhance the effective treatment of this form of skin cancer. A GHRh inhibitor is a medication or chemical which suppresses that production of GHRh by the hypothalamus. GHRh is the precursor to human growth hormone and is released in order to stimulate the pituitary to produce HGH for the body. Unfortunately, for patients with some types of cancer, certain cancer cells have GHRh receptor sites and have the capability to feed off of GHRh to grow. As such, there is a lot of research today dedicated to exploring different potential GHRh inhibitors in an attempt to increase the effectiveness of current cancer treatments. Melanoma is a form of skin cancer that occurs when particular skin cells, known as melanocytes, malfunction. Both men and women get melanoma with similar frequency, but the locations where these tumors develop are different. In men, melanomas most commonly appear on the back, whereas in women, these cancers generally occur on the legs. If caught before they grow into the deeper layers of the skin, then in most cases, the cancer can simply be excised. On the other hand, if the melanoma spreads into the deeper layers of the skin, it becomes much more difficult to treat, and therefore becomes much more dangerous. The most common treatments for melanomas that come back or spread are radiation and chemotherapy. Overall, the survival rate for melanomas that are caught early is around 91%, but those not caught early are much more dangerous. The survival rate drops significantly if melanoma has been given the opportunity to spread. Although melanoma is one of the rarer forms of skin cancer, it boasts the highest mortality rate and is responsible for 3/4 of the deaths associated with skin cancer. Around the world, 232,000 patients were diagnosed with melanoma last year, and 55,000 died as a result of the condition. In a recent study published in the medical journal Cell, 3 different medications were used in an in vitro environment in order to establish their potential efficacy versus melanoma. Researchers used cultured lines of human melanoma and treated them with the 3 GHRh antagonists. One of the 3 potential GHRh antagonists, known as MIA 690, was found to be highly effective at inhibiting the growth of the melanoma, and its effectiveness depended upon the dose that was administered. MIA 690 was able to reduce the growth by 1/3 when administered at 10 molar, and by 1/5 when administered at a 5 molar dose. After proving that the anti-GHRh treatment could work, they then used the treatment on lab rodents which had xenografted melanoma, and the treatment was found to slow down tumor growth by more than 70% among these subjects. Based upon the results of this study, all signs show that GHRh antagonist treatment can likely be used effectively as a part of a comprehensive cancer therapy regimen. When considering HGH therapy or sermorelin acetate therapy, it is important to understand exactly how these treatments work and what the risks and drawbacks of HGH restoration may be. There is no evidence that human growth hormone, GHRh, or GHRh derivatives cause cancer, but there is evidence that these treatments can exacerbate an existing cancer, which is why HGH therapy is not intended for patients that have an active cancer or a recent history of cancer. When on HGH or sermorelin, it is important to keep an eye on one's health and make regular visits to a general practitioner. Generally, patients are evaluated prior to treatment in order to ensure the safety of treatment, as well as whether a patient can benefit from sermorelin or GHRh. After 6 months of hormone therapy treatment, patients return for further evaluation, in which they are examined to make sure that the treatment is working as intended with no side effects. HGH and sermorelin are highly beneficial medical treatments that can help patients with HGH deficiency restore their health and vitality. But it is still a medical treatment, and all medical treatments have their drawbacks and benefits. Both HGH and GHRh antagonists have a place in medical treatment. HGH and sermorelin are used to preserve the benefits of enhanced cellular metabolism, promoted by healthy HGH levels, and GHRh antagonists will soon play a role in the treatment of medical conditions such as melanoma, in which elevated cellular metabolism can be problematic. Most cancer treatments work by starving the cancer, which in many cases also puts a lot of negative pressure on the healthy tissues of the body as well. The goal of cancer treatment is to target cancerous tissues as effectively as possible while having a minimal impact on healthy tissues. Human growth hormone is incredibly important for maintaining the optimal health of a patient, but in the case of cancer, HGH can become problematic because the same cellular processes that benefit the body as a result of human growth hormone also benefit the growth. So in this sense, GHRh antagonists work by depriving the body of the human growth hormone that it needs to function at its best in order to preserve the health and the life of the patient. No. This study emphasizes the importance of participating in physician-monitored HGH therapy. Using HGH without the help of a medical professional can be potentially dangerous, and it is important to be evaluated for health and any signs of cancer before starting therapy. If you found this video informative, please press the like button and subscribe to the channel. Don't forget to hit the notification bell so you don't miss any of my new videos, and please click the link below in the description to learn more about HGH therapy.